Hello, my name is Liz Scharnetzki, and I'm going to be talking today about our research entitled Health Communication Strategies for Promoting COVID-19 Risk-Reducing Behaviors, Preliminary Results from a Social Media Campaign. Broadly in this work, we were interested in examining how different theory-based health communication strategies would impact the reach and engagement of a public education social media campaign on COVID-19. And we felt that this was both important and timely because controlling the COVID-19 pandemic necessitates effective and engaging public health communication that can promote risk-reducing behaviors in spite of the scientific uncertainties about their effectiveness. So to address this need, we conducted a social media-based factorial experiment to test how effective different message framing strategies are for generating public interest and engaging in COVID-19 risk-reducing behaviors. And this research was sponsored by the Bristol-Myers Squibb Foundation through a special COVID-19 grant opportunity and was conducted in collaboration with Rink Advertising and the Maine CDC. Our social media campaign targeted Maine residents and ran on Facebook and Instagram from May 18th through June 7th. In regard to our methodology, we developed messages about 6 different COVID-19 risk-reducing behaviors that are recommended by the Maine CDC. For example, wearing a mask in public, being aware of COVID-19 symptoms, and maintaining a safe distance. Each of these messages was paired with one of 4 social psychological theory-based framing strategies. Either an uncertainty normalizing frame, which was designed to normalize scientific uncertainty about COVID-19 and risk-reducing behaviors. A destigmatizing frame, which was designed to decrease scapegoating and othering. An optimism frame, which was designed to communicate hope and perseverance, or a values affirmation frame, which was designed to affirm societal values. To determine which of these strategies was most effective in generating public motivation to engage in risk-reducing behaviors, we also incorporated a call to action in every message. And this is a way for users to engage more directly with the content that is being shown to them on social media. We had 2 different calls to action that aligned with the behaviors that were being promoted in our messages. Users were either directed to a website with COVID-19 related information, so know the symptoms and warning signs, click here to learn more, and we called this an information gathering call to action. Or users were asked to make a pledge to engage in the risk-reducing behavior that was being promoted in the message. For example, pledge to always wear a mask in public. The motivation behind using these calls to action is that behavioral intentions are a strong predictor of actual behavior. So in this way, our calls to action served as a proxy for behavior. Overall, our social media campaign generated excellent reach and engagement, reaching over 119,000 unique Mainers. Between our 2 calls to action, we generated 8,639 total website clicks and 433 behavioral pledges. Taken together, this produced a click-through rate of 3.85%. A click-through rate is a calculation of how many people actually clicked on one of our messages relative to the number of times one of our messages was being shown. Our click-through rate of 3.85 far exceeds the industry benchmark, which is 0.9%. In assessing the effectiveness of our different messages, we found that message engagement differed not only by the type of call to action being used, so information gathering versus making a behavioral pledge, but also by the various risk-reducing behavior being promoted in the message, as well as the framing strategy being used. So for messages that were aimed at promoting information gathering, messages about symptom awareness generated the most public interest and accounted for 98.5% of all website clicks. In contrast, messages about hand washing only generated 1% of website clicks. We also found that within this call to action, messages that used a destigmatizing frame generated the most engagement, accounting for 48% of all website clicks. Importantly, we found preliminary evidence to suggest an interaction between the behavior being promoted and the framing strategy being used. So for example, the destigmatizing frame drove 47% of all website clicks on symptom awareness messages. For messages that were aimed at eliciting behavioral pledges, mask wearing generated the most interest and accounted for 61% of all behavioral pledges. In contrast, messages about keeping a safe distance only generated about 6% of pledges. Also within the behavioral pledge call to action, we found that messages that used either the uncertainty normalizing or the destigmatizing frame facilitated the most engagement, each generating 31% of pledges. And we again found preliminary evidence to suggest an interaction between the behavior being promoted and the framing strategy being used. For example, the uncertainty normalizing and destigmatizing frame accounted for the majority of pledges to always wear a mask in public. These data provide promising evidence for the utility of theory-based framing strategies in generating public motivation to engage in COVID-19 risk-reducing behaviors. And in particular, we found that messages that address scientific uncertainty and stigma appear to be the most effective and the most engaging. This line of research has the potential to guide public health communication not only about COVID-19, but also about other public health threats and concerns. And the future directions for our message research include a second social media campaign that will be designed to reach new Mainers, as well as developing messages about lung cancer screening and prevention. Thank you so much.